Well, I had a viewer request to do a video on cystic fibrosis and disability. Cystic fibrosis is a very serious disease that causes major lung problems, but cystic fibrosis is fairly rare. So I decided to make a video on general lung problems and disability. And I'm going to talk about cystic fibrosis, but also the two more common lung problems that I see, which are asthma and COPD, which stands for chronic obstructive pulmonary disease. And lung problems are a very complex subject. In fact, diseases of the lungs is a special medical specialty called pulmonology, and huge books are written on diseases of the lungs. And I'm not a lung specialist, but I'm going to go over the basics and the information you should provide if you're applying for disability based on a lung problem. There is a separate section in Social Security's listing of impairments, is section 3.0, respiratory disorders, that addresses disability with people with lung problems. And I'll provide a link to that listing in the description to this video below. Hello, I'm John Foster. I'm a medical doctor who does disability exams for Social Security. And if you find this sort of thing interesting, you might want to subscribe to my channel. I generally put out one disability-related video every Friday. And as usual, everything I say reflects my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. Now, a little bit about breathing itself. We breathe in and out through the mouth and nose. They are connected to the windpipe, which is called the trachea. The windpipe goes down to about here, where it splits off into two tubes called bronchi. One goes to each lung. We have two lungs, one on each side of our chest. These bronchi divide into smaller and smaller tubes, and the very small tubes are called bronchioles. At the end of the bronchioles are the tiny little air sacs called alveoli. The lungs, if you cut them open, they actually look like a dish sponge. Also involved in breathing are the muscles of breathing, which are the muscles in between the ribs, the diaphragm, which is in between the chest cavity and the abdomen, and if someone is very short of breath, we also use the muscles in the neck and the upper back. Problems with any of those structures can cause trouble breathing. Also, trouble breathing is a common symptom of heart disease. I'm not going to be addressing primary heart disease, such as heart failure, in this video. So, what is the purpose of breathing? Well, basically, breathing does three things to keep us alive and keep us healthy. Number one, it supplies oxygen to the body. All of our tissues need oxygen for energy. When we burn food, we're burning it with oxygen. Second of all, when we burn our food and produce energy for the body, we produce carbon dioxide, which is a waste gas. When we breathe out, we exhale that carbon dioxide. And finally, the acid-base status of the blood has to be kept in a very tight range, and the lungs and the kidneys are involved in keeping our blood in the correct acid-base balance. Normally, our blood is just slightly basic, with a pH of about 7.40. A completely neutral pH is the pH of water, which is 7.00. So all lung diseases tend to have similar symptoms, and if you're applying for disability or having a disability exam, you need to describe which of these symptoms you have. The first is shortness of breath. And it's very important that you indicate how short of breath are you. Social Security is primarily going to approve disability if you're short of breath at rest, which means just sitting in a chair you're short of breath, or you're short of breath with minimal exertion, which means something like walking across the room or just walking down the hall to get to the doctor's office. If you're only short of breath with more effort than that, for example, exercising, you might not be approved for Social Security disability. Now, here's a very important point. When I ask disability claimants if they get short of breath easily, I often get this answer: yes, I get short of breath going to the mailbox. Well, that's not helpful because I don't know how far away your mailbox is from your door. Is it 10 feet away or is it a mile away? And I've never met anybody who could tell me how far their mailbox was from the door. I actually measured mine. It's 173 feet from my front door. Doctors generally grade shortness of breath based on how far you can walk before you need to stop and rest, measured in feet, or how many stairs you can climb before you have to stop and rest. If you can't climb one flight of stairs without stopping to rest, doctors consider you significantly short of breath. You must find out. That's your job. Find out your limitations due to shortness of breath and indicate that in your disability application and at your disability exam. The next common symptom is cough, and the doctors and Social Security want to know, do you have a chronic cough? Do you cough frequently and regularly? If you do, is it a dry cough, or do you bring up phlegm, which doctors call sputum? Normal sputum is either clear or white. What doctors call purulent sputum is an indication of inflammation in the lungs, and that's sputum that's either grayish, yellow, brown, or green. Next, do you ever cough up blood? And if so, is it sputum with little streaks of blood, or is it what doctors call frank hemoptysis, which means you cough up blood clots? Finally, a problem that can be caused by lung disease is edema, swelling in the feet, ankles, and lower legs due to water retention. And I'll talk about that more later in this video. The signs that doctors look for in someone with lung disease: first is rapid breathing, called tachypnea. Second is fever. Third is rapid heart rate, called tachycardia. Next is cyanosis. Cyanosis is a bluish discoloration of the skin and lips caused by lack of oxygen in the blood. Next is use of accessory muscles of respiration. If somebody's quite short of breath, they'll be using their neck and upper chest muscles to breathe. Normally, that only happens if someone has done serious exercise, like running a sprint. But some people with chronic lung disease will be using their accessory muscles just sitting in a chair. The next one is increased diameter of the chest. Is the person barrel-chested? That's a sign of destruction of lung tissue, as happens in emphysema. Next, the doctor's going to listen to the lungs and note if there's any abnormal lung sounds. the doctor's going to look for swelling of the feet and ankles, and also swelling of the liver. When there's severe lung disease that affects the heart, it can cause fluid retention in the lower legs, but also fluid retention in the liver. Most people aren't aware if their liver is swollen. They rarely have any symptoms. Now, we come to tests of lung disease, and here lung disease is kind of different from other common disabling conditions in that Social Security puts great importance on lung disease tests. In fact, more importance is attached to lung disease tests than for tests of any other condition, such as back pain, arthritis, or heart disease. And there are certain tests that anybody who's applying for Social Security disability based on lung disease should have, if at all possible, and the test should be done preferably within a year, and then if not within 1 year, within 2 years. The first is an X-ray of the chest. The chest X-ray is very cheap, exposes people to very minimal radiation, and probably provides more information than any other imaging study. The next is called arterial blood gases, or ABG. This is normally taken as a blood sample from the wrist, and it measures the amount of oxygen and carbon dioxide in the blood and how acid or basic the blood is. The next test is called spirometry, also known as pulmonary function tests. In this test, a clamp or clothespin-like device is put on the nose and the person breathes through a mouthpiece, and this measures how large a volume they can breathe in and breathe out and how fast they can breathe out. All of these tests may be ordered and paid for by the Social Security Administration if you're unable to get them done all on your own. Another test is pulse oximetry. You've probably had that done before, where a nurse puts a little clip on your fingertip and it indirectly measures the amount of oxygen in your blood. Social Security will not accept the results of an at-home test, but they may order and pay for a test to be done in a lung testing lab if you haven't had it done by your doctor. Now, here's something important. Social Security wants those tests to be done when your lung condition is stable. If they're done less than 2 weeks after your doctor changed your breathing medicine, they won't accept them. And if they're done less than 4 weeks after an episode where your lung condition got worse, they won't accept them. So say, for example, as is common, you have chronic asthma and you got an episode of pneumonia and were admitted to the hospital several days. Well, Social Security wants those tests done at least 4 weeks after you were discharged from the hospital. They won't accept tests that were done right after you were discharged when you were still recovering from the pneumonia. It also is very helpful for a disability application to have at least one consultation by a pulmonologist, a lung disease specialist. There are some more complicated lung tests that Social Security may want that they will not pay for, but for most common lung diseases, the tests that I've mentioned are enough and Social Security will pay for them if you can't get them done yourself. Now, I already talked about describing your shortness of breath, which is absolutely crucial. The next thing is you want to describe your exacerbations. Most people with chronic lung disease have some breathing trouble every day, but from time to time they get worse, often from a chest infection, although there are other causes. If you get worse and you have to make an urgent appointment with your doctor, or go to an urgent care clinic, or go to the emergency department, get treated and sent home, or get admitted to the hospital, to the intensive care unit, and especially if you're admitted to the hospital to the intensive care unit and need ventilator treatment, artificial breathing machine, it's very important to keep a record of all those exacerbations and tell Social Security about them. Social Security's opinion is that if somebody needs frequent, unscheduled absences from work, such as frequently having to leave work to go to the ER, or go to urgent care, or get admitted to the hospital, that person is disabled. Now, I'm going to finish by talking a little bit about asthma, COPD, and cystic fibrosis. Asthma is a disease where the little air tubes, the bronchioles in the lungs, get narrowed, constricted, so that it's hard for air to move past them. And there are two reasons for that. Number one, there can be increased secretion of mucus and inflammation in those little air passages, clogging them. And also those little air passages have muscle around them, and that muscle can constrict or open up the air passages. If they constrict too much, the person gets trouble breathing. There are medicines to help open up those air passages, and every asthmatic probably has an albuterol inhaler. Albuterol is what we call a bronchodilator. It opens up those little air passages. Asthma typically begins in childhood, but it can begin at any age, and many people have asthma that only begins in adulthood. Asthma may, in some fortunate individuals, go away. It's quite common for childhood asthma to go away as the person gets older, but it may persist into old age. COPD, chronic obstructive pulmonary disease, is made up of two components: bronchitis, which is similar to asthma, increased secretions and fluid in the bronchioles and constriction of bronchioles, and emphysema, which is different from asthma. It's destruction of the little air sacs, the sponges in the lungs. And by those two mechanisms, COPD causes lung disease. By far, the most common cause of COPD is cigarette smoking, although there are other rarer causes. I've always thought it strange that when public health people try to get folks to stop smoking, they emphasize lung cancer. Only a small percentage of people who smoke eventually get lung cancer. However, if you smoke enough cigarettes in enough years, it's absolutely guaranteed that you will get COPD, will be sick, and may die from the COPD. I always thought it made much more sense to emphasize COPD and stop smoking campaigns, but that's just me. Finally, a little bit about cystic fibrosis. Cystic fibrosis is a genetic disease. People are born with it, and it's a genetic defect of salt metabolism. Your body doesn't handle salt properly, and it causes multiple problems, one of which is the mucus in the lungs and bronchioles becomes much thicker and stickier than normal. We always have a little bit of thin, watery mucus lining our bronchioles, but in cystic fibrosis, it becomes sticky like honey or glue and plugs up the air passages in the lungs. This causes problems with breathing, and it also makes the lungs very susceptible to infection, and people with cystic fibrosis tend to get recurrent lung infections, pneumonia and bronchitis over and over and over again. It also causes damage to the pancreas, a gland in the back of the abdomen that does multiple things, one of which is produce insulin. And in cystic fibrosis, the person may have enough damage to the pancreas that they lose the ability to produce insulin and become diabetic and have to give themselves insulin shots. People with cystic fibrosis usually start being sick when they're very young, as babies or toddlers. Cystic fibrosis is a very serious disease, and when I began medical school in the 70s, most people with it died before they reached age 20. There have been a lot of tremendous advantages in treating folks with cystic fibrosis, and now they can live significantly longer, although it is still an incurable, very serious disease. I certainly hope this video has been helpful, and as always, remember, if it happens, it's possible.